The pillars of the new initiative. The initiative is built on two central goals: reducing medical expenses for patients and providing direct financial assistance to ease the economic strain healthcare costs impose on American families. Lowering medical expenses. At its core, the new healthcare initiative aims to tackle one of the most pressing issues in the healthcare arena: high medical costs. By introducing new pricing transparency measures, the initiative requires hospitals and medical facilities to disclose actual prices for procedures and services before offering them to patients. This transparency is intended to empower consumers to make informed decisions about their healthcare, potentially fostering competition that could drive down prices. Furthermore, the plan incorporates steps to reduce prescription drug costs by fostering greater competition in the pharmaceutical industry. This involves streamlining drug approval processes to allow more generic drugs to enter the market, thereby bringing down overall drug prices. Direct financial support. Recognizing the financial challenges faced by many Americans in accessing necessary medical care, the initiative outlines a plan to provide direct financial support to those who need it most. This includes subsidies or tax credits aimed at easing the burden of out-of-pocket expenses for lower and middle-income families. Additionally, the initiative proposes expanding health savings accounts, HSAs, allowing individuals to save more pre-tax dollars for medical expenses. Potential impacts and challenges. While the new healthcare initiative proposes ambitious changes that could lead to more affordable healthcare, its successful implementation will require overcoming several hurdles. Critics argue that increasing market competition and transparency might not be enough to significantly lower healthcare costs without broader reforms. Additionally, healthcare providers and pharmaceutical companies may resist measures that could affect their profitability. The initiative's impact will also heavily depend on coordination between federal, state, and private entities, as well as bipartisan support, which can be challenging in the current political climate. However, proponents argue that these proposed changes could lead to a more efficient and consumer-friendly healthcare system, ultimately benefiting millions of Americans. Conclusion. Trump's new healthcare initiative marks a potentially transformative approach towards alleviating the financial burden of medical expenses and enhancing access to healthcare services. As the administration moves forward with these plans, all eyes will be on its execution and the resulting effects on the healthcare industry and consumer experience. If successful, these reforms could set a precedent for future healthcare policies, navigating the country towards a more affordable and equitable healthcare system.